Outline of congenital heart disease. Congenital heart disease is a problem with the heart structure and function due to abnormal heart development before birth. Congenital means present since birth. Some common congenital heart diseases include type of defect, short description. Ventricular septal defect VSD. There is a hole within the membranous or muscular portion of the intraventricular septum that produces a left to right shunt more severe with larger defects. Atrial septal defect ASD. A hole from a septum secundum or septum primum defect in the interatrial septum produces a modest left to right shunt. Parent ductus arteriosus PDA. The ductus arteriosus, which normally closes soon after birth, remains open and a left to right shunt develops. Tetralogy of Fallot. Pulmonic stenosis results in right ventricular hypertrophy and a right to left shunt across a VSD, which also has an overriding aorta. Transposition of great vessels. The aorta arises from the right ventricle and the pulmonic trunk from the left ventricle. A VSD or ASD with PDA is needed for extrauterine survival. There is right to left shunting. Coarctation of aorta. Either just proximal, that is infantile form, or just distal adult form to the ductus is a narrowing of the aortic lumen leading to outflow obstruction. Diagram 6. Common congenital heart diseases. Ventricular septal defect, that VSD. Atrial septal defect ASD. Coarction of aorta. Patent ductus arteriosus PDA. Transposition of great vessels. Tetralogy of Fallot. Underwriting considerations for congenital heart diseases. Although congenital heart diseases are often considered to be childhood conditions, advances in surgical treatment and management, most babies survive well into adulthood. Prognostic factors in adult patients with congenital heart disease. Prognosis is determined by the size and type of defect and other associated congenital anomalies. Below listed are some key prognostic factors while assessing congenital heart disease. Positive prognostic features, negative prognostic features, biventricular circulation, a systematic left ventricular, repair at early stage, good functional capacity, minor hemodynamic license. Negative prognostic features, early surgical era, long-standing palliation, ventricular dysfunction, arrhythmias, pulmonary hypertension, complex or multiple lesions. Prognostic categories for adults treated or operated for various congenital heart diseases: good, intermediate, uncertain, or poor. Atrial septal defect, tetralogy of Fallot, that is intermediate, uncertain or poor, transposition of great vessel. Patent ductus arteriosus, pulmonary stenosis, ventricular septal defect, intermediate, tetralogy of Fallot, uncertain or poor, abstains anomaly, single ventricular cycle. Underwriting requirements include results of investigations like ECG, 2D echocardiography, pre-treatment and post-treatment hospital reports including details of surgical treatment taken, any indications or past or present symptoms like palpitations, shortness of breath, current flow reports and cardiac status. Depending on the type of congenital heart disease and the prognostic factors, terms can vary from standard rates to declinature. Summary: the cardiovascular system is also known as the circulatory system of the human body. The three main components of cardiovascular system are heart, lungs, and blood vessels. There are two cardiovascular systems which operate within the human body: the pulmonary circulation system and the systemic circulation system. Generally, the term cardiovascular system is used for systemic circulation. The adult heart is present in the thoracic cavity between the two lungs. The the heart of a human being is designed as a pump and is divided into four chambers. There are three major blood vessels in the human heart: arteries, capillaries, and veins. Diseases that affect the heart or the blood vessel system of a human body are categorized as cardiovascular diseases. High blood pressure or hypertension is an example of cardiovascular disease that affects the blood vessel system of a human body. Coronary artery disease or CAD is caused by the process of atherosclerosis, also known as hardening or clogging of arteries. Val- Valvular heart disease occurs due to damage or defect in the heart valves. Congenital heart disease is a problem with the heart structure and function due to abnormal heart development before birth. Most congenital heart diseases are diagnosed during pregnancy ultrasound. Some congenital heart disease can be treated with the medication alone, while others require heart surgery. Special senses disorders of the eyes, ears, and nose. Chapter 15 deals to provide an understanding of the functions of the eyes, ears, and nose. This chapter also discusses the various disorders associated with these organs and the underwriting implications relating to them. Learning outcomes: understand the functioning of the eyes and various disorders of the eyes. Understand the functioning of the ears and various disorders of the ears. Understand the functioning of the nose and various disorders of the nose. Understand the functioning of the eyes and various disorders. Parts of the eye. Eye is the organ of sight. The eye can be compared to a camera which gathers light and transforms it into a picture. Anatomy of the eye. The eye is spherical in shape and is situated in the cavity of the skull called orbit. Diagram 1: parts of the eye: retina, sclera, iris, lens, pupil, cornea, optic nerve. Pupil: hole in the center of the eye through which light passes through. Iris: circular band of muscles that control the size of the pupil. Pigmentation of the iris gives a color to the eye. Cornea: transparent tissues covering the front of the eye. Conjunctiva: mucous membrane which covers the sclera and the inside of the eyelids. Sclera, also known as the white of the eye, it protects the inner parts. Lens: highly elastic biconvex body which bends light passing through the eye, enabling us to change focus according to different distances. Retina, layer of tissue at the back of the eye which contains photoreceptors called the rods and cones. Vitreous humor is a clear gel which provides constant pressure to maintain the shape of the eye. Functioning of the eye. Light passes through the cornea, pupil, and lens before hitting the retina. The iris is the muscle that controls the size of the pupil and therefore the amount of light which passes through it. The retina contains the receptor which respond to light. These receptors generate impulses which travel to the brain via optic nerve. Disorders of the eye: cataract, glaucoma, retinopathies, retinal detachment, refractive error, blindness, strabismus squint. Cataract. It is the formation of opacities on the lens of eye which results in obstruction to passes the light, leading to clouding of vision. Types of cataract include age-related, that is senile, congenital, traumatic or duosystemic diseases like DM, prolonged corticosteroid treatment, etc. The rate of progression varies. In the early stages, visual acuity can be corrected with glass, but later may require surgery. Underwriting: age at onset of cataract formation, cause, degree of visual impairment, and any residual complications post treatment should be looked for. For life benefit, no ratings are usually required. Glaucoma. These are disorders often associated with increased intraocular pressure in the eye, that is aqueous humor. This can result in damage to the optic nerve, which leads to impaired vision. The types of glaucoma include primary glaucoma. It is of two types: open angle, seen in people above the age of 50 years; angle closure glaucoma. Congenital glaucoma, it is an abnormality since birth which results in increased intraocular pressures. Secondary glaucoma, it is caused due to other diseases, for example, eye dislikes like uveitis. Treatment is aimed at treating the cause, and medications are given to reduce the intraocular pressure. Underwriting: the degree of visual impairment, cause of glaucoma, and effect on applicant's occupation would influence underwriting. Rates are usually for underlying cause rather than for glaucomas itself. Retinopathies. These are disorders of the retina due to various causes resulting in unilateral or bilateral loss of vision. Example: diabetic and hypertensive retinopathy brings about changes in retinal blood vessels, leading to loss of vision and retinal detachment. Underwriting: this condition can be of significant concern for life, critical illness, and total permanent disability coverage, and the underwriting approach will depend on the extent of damage and the underlying cause. Retinal detachment, painless condition which occurs when a tear in the retina develops due to trauma, DM, high myopia, tumors, idiopathic, etc. The detachment may be progressive if left untreated and can lead to significant vision loss. Refractive error. Normal vision is expressed as visual acuity. A person is said to have normal vision if the visual acuity is 6 by 6. For example, If the usual acuity is said to be 6 by 12 means that a applicant can see at 6 meters what a person with normal vision can see at 12 meters. Types of refractive errors include myopia, person has near sight, can see objects near him, myopia. Hypermetropia, person has far sight, can see distant objects better. Hypermetropia. Underwriting refractive errors can be corrected with glasses. Some may undergo surgery. LASIK for correction. No ratings are generally required for refractive errors. Blindness. It is the inability to see. It may be congenital or acquired. It may be partial or complete and unilateral or bilateral. Color blindness. It is impairment of color perception. This is usually congenital. Underwriting will depend upon cause of blindness, residual visual acuity, and many impairment of functional capacity, occupation, progressive, any systemic disorders. For life benefits, disorders of the eye usually do not attract underwriting ratings by themselves, but ratings may be applicable for the underlying cause. For a critical illness benefit, special considerations need to be given as blindness is usually covered with critical illness policies. Strabismus or squint. It is weakness or defective nerve supply to the extraocular muscle which results in inability of the eyes to move together. Squint can be congenital or may occur due to systemic neurological disorders like stroke or DM. It can result in diplopia, double vision. In children, the affected eye is suppressed and, if left untreated, cause blind eye. Amblyopia, blind eye. Underwriting will depend on the cause of the squint, example congenital due to a neurological disease, the present visual acuity, any progression, the effect of this impairment on the occupation of the insured. Understand the functions of the ears and various disorders of the ears. Parts of the ear. The ear is the external organ of hearing, balance, and equilibrium. It is divided into three parts: outer ear, middle ear, inner ear. Outer ear, it includes the external auditory canal. This is an S-shaped tube extending from the visible auricle and the tympanic membrane. Eardrum. The eardrum separates the external ear from the middle ear. It vibrates as sound waves enter the ear. Middle ear. This is an air-filtered cavity containing three small bones called ossicles. These ear bones transmit sound waves received from the eardrum to the oval window and the inner ear. Air enters the middle ear cavity through the Eustachian tube, which connects the middle ear to the nasopharynx. This tube helps in equalization of pressures on both sides of the drum. Inner ear. It contains organs of hearing and balance called labyrinth. These extend from the oval window to the auditory nerve. The nerve carries the sound impulses to the brain. Diagram 3. Parts of the ear. Outer ear, inner ear, middle ear, eardrum, ear canal, Eustachian tube. Disorders of the ear. Otitis, acute otitis media, chronic otitis media, deafness. Otitis, it is the inflammation of the ear. Acute otitis media, it is the acute inflammation of the middle ear cavity. This infection can spread to the mastoid bone above the ear. The inner ear, that is labyrinthitis, or to the brain, meningitis. Chronic otitis media, this causes permanent perforation of the tympanic membrane, eardrum, and can spread like acute otitis media. It can result in conduction defects in the ear. Deafness, it is the loss of hearing. Hearing loss may be unilateral or bilateral, total or partial. There are two types of hearing loss: conduction deafness and sensory neural deafness. Conduction deafness. In this, the sound impulses do not pass from the external ear to the inner ear. It can occur due to congenital conditions, trauma, impaired ear wax, eardrum perforation, otosclerosis, etc. Sensory neural deafness. It is deafness which occurs due to damage to the sensory cells in the inner ears or to the damage to the nerve that transmits impulses to the brain. Its causes include congenital trauma, infections like mumps or measles, Meniere's disease, etc. Presbyacusis is sensory neural hearing loss with some conductive component seen in old age. The auditory test is done to measure hearing, and depending on the cause, the treatment will differ. Underwriting consideration should include type and degree of hearing loss and whether it is progressive, cause, local or systemic, occupation, any associated complications. For life benefit, disorders of the ear do not usually attract ratings by itself, but ratings may be applicable for the underlying cause. For critical illness benefit, special considerations need to be given, as deafness is usually covered under critical illness policies. Understand the functions of the nose and various disorders of the nose. Functioning of the nose. The nose is made up of bone and cartilage. It filters and moistens the air that is inhaled. It is also the organ for smell. The bones of the face around the nose contain a hollow space called paranasal sinuses. The two nostrils are separated by the nasal septum. Functioning of the nose. The names of the parts: adenoids, soft palate, nose, hard palate, tongue, oesophagus, trachea. Disorders of the nose: deviated nasal septum, sinusitis, nasal polyp. Deviated nasal septum. Usually, the nasal septum between the nostrils is straight. Occasionally, since birth or due to trauma, there is deviation of the septum, resulting in one nostril being smaller than the other. Severe deviation can block one side of the nose and the result in sinusitis. The deviated septum may require surgery. No rating is required for deviated nasal septum. Sinusitis. It is the inflammation of the sinuses. In this condition, the membrane of the sinuses gets inflamed and may progress to the sinus cavities, which become filled with infected material. This is usually an acute condition and does not require any rating. Nasal polyp. These are fleshy outgrowths of mucosa of the membrane of the nose. They may occur due to infections or due to allergies. If the nasal polyps produce significant symptoms, they may require excision with surgery. Underwriters should call for histopathology reports to rule out any malignancy if surgery has been done in the recent past. Summary. Eye is the organ of sight that gathers light and transforms it into a picture. Parts of the eye include pupil, iris, cornea, conjunctiva, sclera, lens, retina, and vitreous humor. Functioning of the eye, light passes through the cornea, pupil, and lens before hitting the retina. The retina contains the receptors which respond to light. These receptors generate pulses which travel to the brain via the optic nerve. Disorders of the eye include cataract, glaucoma, retinopathies, retinal detachment, refractive error, blindness, and strabismus or squint. The ear is an external organ of hearing, balance, and equilibrium. The ear is divided into three parts: outer ear, middle ear, and the inner ear. The disorders of the ear include otitis, acute otitis, chronic otitis media, and deafness, etc. For life benefit, disorders of the ear do not usually attract ratings by themselves, but the ratings may be applicable for the underlying cause. The nose filters and moisturizes the air that is inhaled. It is also the organ of smell. The two nostrils are separated by the nasal septum. The orders of the nose include divided nasal septum, sinusitis, nasal polyp, etc.